Welcome back to the channel. Last week we talked about why the traditional seek and destroy model of acne is broken. Today we are going deeper into the mechanisms. We are going to look at exactly why harsh treatments can make acne worse and what the evidence tells us about the connection between acne, barrier impairment, lipid depletion, transepidermal water loss, and inflammation. Because when we understand the skin barrier, acne actually stops looking like a simple oil problem. It starts to look like a structural problem. Now, if you have been in a treatment room for any length of time, you know this client. They come in with acne. They are using aggressive cleansers, strong acids, drying spot treatments, and maybe a prescription topical, and sometimes even multiple exfoliating products all at once. Their skin is red, tight, flaky, shiny, dehydrated, and they are still breaking out. So the question becomes why? Why is the skin being treated so aggressively and still not improving? The answer is that we are often treating the symptom while ignoring the structure. Let's have a look at what research shows about acne-prone skin. Acne-prone skin is not simply oily skin. It is often barrier-impaired skin. Studies show that acne-prone skin can have decreased ceramide levels in the stratum corneum, increased transepidermal water loss, and changes in the structural organization of the barrier. Now, that means that the barrier is already compromised before the client ever starts using harsh acne products. It is such an important point. The skin is already vulnerable and it already has difficulty holding water. So it already has a disrupted lipid environment. So when we look at acne, we cannot only look at the breakout, we have to look at the barrier deficit underneath that breakout. Okay, so what happens when we apply a strong stripping active agent to the skin that already lacks essential lipids? We accelerate the damage. We increase the stress on the stratum corneum. We remove more lipids from the barrier that is already deficient. And when the barrier becomes more impaired, transepidermal water loss increases even further. The skin loses more water. The surface becomes tighter, drier, more reactive, and less able to function properly. And this is where harsh acne treatments can backfire. Because the more aggressive we try to dry the acne, the more we actually destabilize the very structure the skin needs in order to recover. This is the impact of harsh actives. First, they're going to accelerate lipid depletion. The barrier needs ceramides, cholesterol, and free fatty acids to function properly. When those lipids are depleted, the mortar between the cells becomes weaker. Second, enzymatic desquamation begins to stall. The enzymes that are involved in healthy shedding require adequate hydration to function. When TEWL increases and the skin becomes dehydrated, that normal shedding becomes impaired. The dead cells accumulate. The follicle becomes more congested. And third, the skin may respond by increasing sebum production. So now we have created the exact condition, essentially, that we were trying to treat in the first place. We've stripped the skin to reduce the oil. However, the skin interprets that stripping as stress. And in response, it may even produce more oil to compensate for the oil that we've stripped. This is why I often say that we are inducing the exact symptoms that we are trying to treat when we are continuously stripping the skin. Now, let's talk about inflammation. Acne is not just oil. Acne is not just bacteria. Acne is not just an inflammatory disease. And this is where the traditional model misses the deeper mechanisms. We often talk about the Cutibacterium acnes as though it is the villain, but C. acnes is the normal part of a healthy skin microbiome. It becomes more problematic when the follicular environment changes, when there is congestion, reduced oxygen, altered sebum composition, impaired barrier function, and immune activation. So the question is not simply how do we kill the bacteria? The better clinical question is actually what environment is allowing the inflammation to continue. This is the inflammation trap. Acne is an inflammatory disease. Barrier disruption triggers an immune response, and stripping agents add exogenous stress. When the barrier is compromised, the skin is going to be more exposed to external irritants and internal inflammatory signaling. The microbiome becomes less stable, the immune system becomes more reactive, and the immune response contributes to the redness, the swelling, the tenderness, pus, and prolonged healing. So when we apply harsh treatments to the already inflamed skin, we may be adding more fuel to the fire. We may be increasing the inflammatory cascade instead of calming it down, which is what we're aiming for. You cannot calm an inflammatory condition by repeatedly applying treatments that induce inflammation. The goal is not to attack the breakout harder. The goal is to calm the system that is driving the breakout. So this is why a corneotherapeutic approach is so important in acne care. We have to stop thinking about acne as an oil problem. It's not just oil. We have to start thinking about it as a barrier and inflammation problem. It does not mean that we ignore congestion. It does not mean that we never use actives. It just means that the barrier has to come first. Because if the skin is inflamed, dehydrated, lipid deficient, and reactive, aggressive correction often creates more instability for the skin, fueling the exact same problem. Okay, with that said and done, the first clinical priority is always to restore the structure so that the skin can regulate itself again. This is the clinical solution on screen. Prioritize the barrier restoration, supply physiological lipids, calm that inflammation cascade, and that means supporting the skin with the lipids it actually recognizes and needs. It means ceramides, cholesterol, and free fatty acids. It means reducing transepidermal water loss, and it means supporting healthy desquamation instead of forcing exfoliation on the skin that is already depleted. And it means reducing inflammatory stress so that the skin can move out of survival mode. When you repair structure, the symptoms often begin to resolve themselves. Not because we're ignoring the acne, but because we address the condition that was allowing the acne pattern to continue in the first place. This approach, however, does require patience. It requires client education, and it also requires helping clients move away from instant gratification of stripping, drying, and peeling. But if the goal is long-term skin health, barrier repair is not optional. It is foundational instead. So if you want to master this level of clinical reasoning and learn about how to truly analyze what is happening in the skin beyond just surface symptoms and product protocols, this is exactly what we cover inside my Professional Skin Assessment Mastery program. We look at the structure, we look at the function, we also look at the mechanism of the cells involved. And when we build treatment strategies that support the biology of the skin instead of fighting against it, we get real long-term sustainable results for our clients. Thank you guys so much for watching. Please like, subscribe, and share this with a colleague who wants to understand acne beyond the dried out model. And I will see you next week.